It was to examine whether a simple screening test for abdominal aortic aneurysms, peripheral arterial disease and hypertension would reduce overall mortality in men aged 65 to 74. The key finding was that we saw a very significant reduction in overall mortality by 7%. A bit of a translation is that we only need to invite 169 men in order to save one life within 5 years. That's good odds for a lottery, I think. To our knowledge, no established cancer screening program in the Western world have ever been able to show any reduction in overall mortality. So it's a quite powerful result. We tried to try to find out which part of the screening programs actually were working, and we could see that aneurysm-specific mortality, that wasn't the major driver. And if we excluded all those being started on antihypertensives after the screening, that wasn't the driver. So the driver of the result is those having aneurysms or PAD that was placed upon general cardiovascular prevention. And today, that's not a common indication for cardiovascular prevention if you don't have coexisting heart disease or symptoms. But all patients with AAA or PAD ought to receive a proper prevention. Well, actually, it was inspired by when the Gordon Brown administration wanted to implement a national based screening offer for 65-year-old men in England for abdominal aortic aneurysms, and vascular surgeons suggested why not screen for PAD when they're lying on the bench, but due to no evidence, they only implemented solitary aneurysm screening. So that was the inspiration. The costs we have calculated quite robust and very detailed costs of the screening program, and we found it quite cost attractive and highly competitive with the cancer screening programs. So that would definitely not be an obstruction for saying we should not do this. And for nations as Sweden, Great Britain, where you already have established nationwide screening programs for aneurysms, it would be quite easy to add on. But and for the many countries who are considering to screen for AAA, they should certainly consider to add on PAD screening and hypertension.